Question 1. A CCMA is preparing to administer an intramuscular injection to an adult patient. The medication insert specifies a Z-track method. Which of the following best describes the primary purpose of using the Z-track technique? A. To ensure faster absorption of the medication into the bloodstream. B. To reduce the patient's pain at the injection site. C. To prevent medication from leaking back into the subcutaneous tissue. D. To minimize the risk of hitting a nerve or blood vessel. Answer: C. To prevent medication from leaking back into the subcutaneous tissue. This question tests your knowledge of specific injection techniques, particularly the Z-track method, and its main purpose. The keyword primary purpose directs you to the core reason this technique is used. The Z-track method involves pulling the skin and subcutaneous tissue to one side before injection, then releasing it after the needle is withdrawn, which creates a zigzag path that seals the medication deep in the muscle and prevents it from seeping back into the superficial layers. This is especially important for irritating medications or those that can stain the skin. Always remember that the Z-track method is like creating a seal to keep the medicine where it belongs in the muscle. Question 2. A patient reports feeling lightheaded and dizzy while having blood drawn. The CCMA immediately lowers the patient's head and elevates their legs. Which physiological response is the CCMA primarily trying to counteract? A. Hypoglycemia. B. Vasovagal syncope. C. Anaphylactic shock. D. Hyperventilation. Answer: B. Vasovagal syncope. This question assesses your understanding of common patient reactions during procedures and appropriate interventions, with the keywords lightheaded and dizzy and blood drawn strongly suggesting a specific type of faint. Vasovagal syncope, a temporary loss of consciousness caused by a sudden drop in heart rate and blood pressure, is a common reaction to stress, pain, or fear during venipuncture. Lowering the head and elevating the legs helps restore blood flow to the brain, directly addressing the core issue of reduced cerebral perfusion. This quick action can prevent a full syncopal episode or minimize its severity, so always position patients safely if they start feeling faint during a procedure. Question 3. A CCMA is performing a spirometry test. The patient consistently fails to exhale for the minimum required 6 seconds despite coaching. Which of the following is the most appropriate next step for the CCMA? A. Document the patient's poor effort and conclude the test. B. Instruct the patient to try even harder, emphasizing the need for 6 seconds. C. Encourage the patient to try 3 more times, then refer them for further evaluation if unsuccessful. D. Verify patient understanding of the instructions and assess for any physical limitations or discomfort. Answer: D. Verify patient understanding of the instructions and assess for any physical limitations or discomfort. This question evaluates your critical thinking and patient assessment skills during diagnostic procedures, especially when a patient struggles despite initial coaching. The keywords consistently fails and despite coaching indicate a need for deeper investigation rather than just more instruction. Before abandoning the test or forcing further attempts, the CCMA should explore underlying reasons such as misunderstanding instructions, physical pain, or pulmonary limitations that prevent them from performing the maneuver correctly. Addressing these factors first ensures the most accurate test results and maintains patient comfort. Always remember to assess and adapt your approach when a patient isn't responding as expected during a procedure. Question 4. A CCMA observes a blood specimen for a PT/INR test that has clotted in the light blue top tube. The patient is no longer available. What is the most appropriate action? A. Remove the clot, then centrifuge the specimen for testing. B. Document the issue and redraw the specimen from the patient at a later time. C. Label the specimen as clotted and send it to the lab with a note. D. Centrifuge the clotted specimen and test the remaining plasma. Answer B. Document the issue and redraw the specimen from the patient at a later time. This question tests your understanding of proper blood collection and handling, especially for coagulation studies. The keyword clotted in the light blue top tube is critical, as these tubes contain sodium citrate to prevent clotting for PT/INR tests. Once a specimen clots in a tube designed to prevent clotting, it is considered compromised and cannot be used because the clotting process consumes coagulation factors, leading to inaccurate results. The only correct action is to document the incident, discard the compromised sample, and collect a new specimen from the patient, as there's no way to salvage a clotted coagulation sample. Always prioritize patient safety and accurate results over trying to salvage a compromised sample. Question 5. A patient calls the clinic complaining of severe chest pain and shortness of breath. The CCMA should advise the patient to A. Take 2 aspirin and wait for the doctor to call them back. B. Come to the clinic immediately for an urgent appointment. C. Call 911 or go to the nearest emergency room. D. Rest at home and monitor their symptoms closely. Answer C. Call 911 or go to the nearest emergency room. This question assesses your ability to recognize critical symptoms and prioritize patient safety during a phone triage scenario. The keywords severe chest pain and shortness of breath are classic indicators of a potential medical emergency, such as a heart attack or pulmonary embolism, requiring immediate medical attention. Directing the patient to call 911 or go to the emergency room ensures they receive rapid, life-saving care that cannot be provided in an outpatient clinic. In situations involving acute, life-threatening symptoms, it's always safest to advise immediate emergency services rather than waiting for an appointment or attempting self-treatment. Question 6. A CCMA is setting up an exam room for a minor surgical procedure. Which of the following best describes the appropriate method for preparing sterile instruments for use? A. Open sterile packages over the sterile field, dropping contents directly onto it. B. Place instruments from unsterile packages directly onto the sterile field. C. Touch only the handles of the instruments with sterile gloves, then place them. D. Tear open sterile packages and slide the instruments onto the sterile field from the side. Answer A. Open sterile packages over the sterile field, dropping contents directly onto it. This question focuses on maintaining sterility during a medical procedure, a critical aspect of infection control. The phrase preparing sterile instruments emphasizes the need to prevent contamination. When adding instruments to a sterile field, packages should be opened carefully while holding them above the sterile field, allowing the instruments to fall directly onto the field without touching the edges of the package or any non-sterile surfaces. This technique ensures that only the sterile contents come into contact with the sterile field, protecting the patient from infection. Always remember to avoid reaching across the sterile field or touching its edges, maintaining a safe distance for maximum sterility. Question 7. According to CLIA regulations, which of the following laboratory tests can a CCMA typically perform in an outpatient setting without special certification? A. Blood cultures. B. Arterial blood gases. C. Urine dipstick. D. Complete blood count, CBC. Answer C. Urine dipstick. This question tests your knowledge of CLIA, Clinical Laboratory Improvement Amendments, regulations, specifically concerning the complexity levels of laboratory tests that CCMAs can perform. The keyword "without special certification" points to tests classified as waived. Waived tests are simple laboratory procedures with a low risk for error and are approved for home use or in facilities with a certificate of waiver, which includes common outpatient settings. Urine dipstick analysis is a classic example of a waived test, while blood cultures, arterial blood gases, and CBCs are considered more complex and require specific training, certification, or more advanced laboratory settings. Always understand the CLIA classification of tests to know what procedures fall within your scope of practice. Question 8. A patient has a known allergy to latex. Which of the following actions is most crucial for the CCMA when preparing to draw blood from this patient? A. Use a smaller gauge needle to minimize trauma. B. Ensure all materials, including bandages and gloves, are latex-free. C. Apply a tourniquet for a shorter duration to prevent skin irritation. D. Have epinephrine readily available in the room. Answer: B. Ensure all materials, including bandages and gloves, are latex-free. This question addresses patient safety and managing known allergies during clinical procedures. The keyword "known allergy to latex" signals the paramount importance of preventing exposure. The most crucial action is to proactively select only latex-free supplies for the entire procedure, from gloves and tourniquets to bandages and antiseptic wipes, to avoid an allergic reaction. While having epinephrine available is important in case of a severe reaction, preventing the exposure in the first place is the primary and most effective safety measure. Always diligently check for and accommodate all patient allergies to ensure a safe medical environment. Question 9. A CCMA accidentally pricks their finger with a contaminated needle after drawing blood from a patient. What is the immediate first step the CCMA should take? A. Report the incident to their supervisor. B. Wash the affected area with soap and water. C. Squeeze the wound to promote bleeding. D. Go to the emergency room immediately. Answer: B. Wash the affected area with soap and water. This question assesses your knowledge of immediate post-exposure protocols following a needlestick injury, which is a critical aspect of workplace safety. The keyword "immediate first step" indicates the initial action to mitigate potential harm. The protocol for a needlestick injury begins with cleaning the wound thoroughly with soap and water to physically remove contaminants and reduce the risk of infection. Following this, the incident must be reported to a supervisor, and post-exposure evaluation and treatment initiated according to facility policy. Remember, washing the area is the very first thing you do to protect yourself after a sharps injury. Question 10. A CCMA is educating a patient about collecting a 24-hour urine specimen at home. Which of the following instructions is most important to include? A. Collect the first morning urine void on the second day. B. Discard the first urine void of the collection period. C. Store the collection container in a warm, dark place. D. Add a preservative tablet to each voided sample. Answer: B. Discard the first urine void of the collection period. This question tests your knowledge of specific instructions for accurate 24-hour urine collection, a common diagnostic test. The keyword "most important" highlights a crucial step for accurate results. For a 24-hour urine collection, the patient must begin the collection by discarding the first void of the day, then collecting all subsequent urine for the next 24 hours, including the first void of the following day. Discarding the initial void ensures that the collection starts with an empty bladder, providing a truly comprehensive sample of substances excreted over the full 24-hour period. Always emphasize starting the collection correctly to ensure the integrity of the diagnostic test. Question 11. A CCMA is preparing to assist with a gynecological exam. Which of the following is the most appropriate action to ensure patient comfort and privacy? A. Position the patient in lithotomy position before the provider enters. B. Keep the door slightly ajar to allow for quick entry by the provider. C. Hand the patient a gown and explain how to put it on, then leave the room. D. Remain in the room during the entire examination to chaperone. Answer: C. Hand the patient a gown and explain how to put it on, then leave the room. This question addresses crucial aspects of patient care, privacy, and comfort during sensitive examinations. The keywords patient comfort and privacy emphasize the need for respectful and appropriate preparation. Providing a gown, explaining its use, and then stepping out of the room allows the patient the privacy to disrobe and don the gown without feeling rushed or exposed. While chaperoning is often necessary during the exam itself, the initial preparation phase requires allowing the patient personal space. Always prioritize patient dignity by providing clear instructions and ensuring privacy before any sensitive examination. Question 12. During a routine venipuncture, the patient reports a sudden, sharp, radiating pain down their arm. The CCMA should immediately A. Adjust the needle position slightly. B. Remove the tourniquet and needle. C. Ask the patient to clench their fist. D. Reassure the patient and continue the draw. Answer: B. Remove the tourniquet and needle. This question assesses your response to adverse patient reactions during venipuncture, a critical skill for patient safety. The keywords sudden, sharp, radiating pain are a strong indicator of potential nerve involvement or injury. In such a situation, the immediate and safest action is to completely remove both the tourniquet and the needle to prevent further damage to a nerve or other structures. Adjusting the needle or continuing the draw could exacerbate the injury. Always prioritize patient safety. If a patient reports sharp, radiating pain during a blood draw, stop the procedure immediately. Question 13. A CCMA is documenting a patient's vital signs. The patient's blood pressure is 150/92 mmHg. According to current guidelines, how would this reading be classified for an adult? A. Normal. B. Elevated. C. Stage 1 hypertension. D. Stage 2 hypertension. Answer: C. Stage 1 hypertension. This question tests your understanding of blood pressure classifications, a fundamental component of vital signs assessment. The reading of 150/92 mmHg is the key data point. According to the American Heart Association, AHA, and American College of Cardiology, ACE, guidelines, stage 1 hypertension is defined as a systolic pressure between 130 to 139 mm of mercury or a diastolic pressure between 80 to 89 mm of mercury. Since 150 mm of mercury is above 139 mm of mercury, and 92 mm of mercury is above 89 mm of mercury, this reading falls into stage 1 hypertension. Knowing these ranges is crucial for identifying potential health risks and ensuring proper patient care and follow-up. Question 14. A CCMA is preparing to perform an EKG on a patient with dextrocardia. Which of the following modifications is essential for accurate results? A. Place all limb leads on the opposite limbs. B. Reverse the V1 and V2 electrode placement. C. Place precordial leads on the right side of the chest. D. Increase the EKG machine's gain setting. Answer: C. Place precordial leads on the right side of the chest. This question delves into specialized EKG lead placement for a less common anatomical variation. The keyword dextrocardia refers to a condition where the heart is located on the right side of the chest instead of the left. For an accurate EKG on a patient with dextrocardia, the precordial, chest, leads, V1-V6, must be placed on the right side of the chest in a mirror image of standard placement, often noted as VR1-VR6. This essential modification ensures that the electrical activity of the heart is correctly recorded. Always remember to adapt your lead placement for anatomical variations like dextrocardia to avoid misdiagnosis. Question 15. A patient presents with symptoms of a severe allergic reaction, including widespread hives, difficulty breathing, and a rapid, weak pulse. The CCMA should anticipate the provider will order which medication first? A. Diphenhydramine, Benadryl. B. Albuterol. C. Epinephrine. D. Prednisone. Answer: C. Epinephrine. This question assesses your ability to recognize and prioritize interventions for a life-threatening allergic reaction. The keywords widespread hives, difficulty breathing, and a rapid, weak pulse are classic signs of anaphylaxis, a severe and potentially fatal systemic allergic reaction. Epinephrine is the first-line and most critical medication for anaphylaxis because it quickly counteracts the life-threatening symptoms by constricting blood vessels, relaxing airway muscles, and improving heart function. While other medications might be used later, epinephrine is the immediate treatment needed to stabilize the patient. Always act swiftly in suspected anaphylaxis, as every second counts. Question 16. A CCMA is responsible for cleaning and sterilizing instruments. Which of the following methods provides the highest level of microbial destruction? A. Disinfection. B. Sanitization. C. Autoclaving. D. Ultrasonic cleaning. Answer: C. Autoclaving. This question tests your knowledge of infection control methods and their efficacy. The phrase highest level of microbial destruction refers specifically to sterilization. Autoclaving uses saturated steam under pressure to achieve sterilization, effectively destroying all forms of microbial life, including spores, which is the gold standard for instruments used in invasive procedures. Disinfection, sanitization, and ultrasonic cleaning reduce microbial load but do not eliminate all spores, meaning they are not considered sterilization methods. Always remember that autoclaving is the most reliable method for achieving true sterility in a clinical setting. Question 17. Which of the following is an example of an open-ended question a CCMA might ask during patient intake? A. Are you experiencing any pain today? B. Can you describe what brings you in today? C. Did you take your medication this morning? D. Do you have any allergies? Answer: B. Can you describe what brings you in today? This question focuses on effective communication techniques in patient interactions, specifically identifying an open-ended question. The keyword open-ended means the question cannot be answered with a simple yes or no and encourages the patient to provide more detailed, descriptive information. Asking, "Can you describe what brings you in today?" prompts the patient to elaborate on their symptoms and concerns in their own words, providing more comprehensive data than a closed-ended question. Using open-ended questions helps build rapport and gather a richer understanding of the patient's condition. Question 18. A CCMA is performing a urinalysis using a reagent strip. Which of the following factors can cause a falsely elevated protein result on the strip? A. Dilute urine. B. Highly alkaline urine. C. Ascorbic acid ingestion. D. Refrigerated specimen. Answer B. Highly alkaline urine. This question probes your understanding of potential interferences in laboratory testing, specifically urinalysis reagent strips. The keyword falsely elevated protein result points to a factor that can skew the test higher than it actually is. Highly alkaline urine, pH greater than 8.0, can sometimes produce a false positive or falsely elevated protein result on reagent strips because the test pad's buffer system becomes overwhelmed, leading to a color change even without significant protein. Conversely, dilute urine might lower results, and ascorbic acid can interfere with other tests but not typically protein. Always be aware of factors like urine pH that can impact reagent strip accuracy. Question 19. A CCMA is preparing to administer an oral medication to a patient. After verifying the 5 rights of medication administration, the patient states, "I don't think I'm supposed to take that one." What is the most appropriate action? A. Administer the medication as prescribed, reassuring the patient it is correct. B. Document the patient's refusal and inform the provider. C. Double-check the medication order against the patient's statement and clarify with the provider if necessary. D. Ask the patient why they believe the medication is incorrect. Answer C. Double-check the medication order against the patient's statement and clarify with the provider if necessary. This question highlights a critical safety principle in medication administration, emphasizing patient advocacy and error prevention. The keywords "patient states, I don't think I'm supposed to take that one" signal a potential discrepancy or patient concern that must be thoroughly investigated. The most appropriate action is not to immediately administer or simply document refusal, but to re-verify the order against the patient's concern and, if any doubt remains, to clarify directly with the prescribing provider. This ensures patient safety by preventing potential medication errors. Always empower patients to voice concerns and never hesitate to seek clarification if a patient questions their medication. Question 20. A patient presents with a laceration that is actively bleeding heavily. After applying direct pressure, which of the following is the most appropriate next step for the CCMA? A. Apply a tourniquet above the wound. B. Elevate the injured extremity above the level of the heart. C. Cleanse the wound thoroughly with antiseptic solution. D. Cover the wound with a sterile dressing and secure it. Answer B. Elevate the injured extremity above the level of the heart. This question tests your knowledge of immediate first aid for severe bleeding, a critical emergency skill. The keywords "actively bleeding heavily" and "after applying direct pressure" indicate that direct pressure alone may not be sufficient, and further steps are needed. Elevating the injured extremity above the level of the heart helps to reduce blood flow to the area through gravity, which can significantly slow down heavy bleeding when combined with direct pressure. A tourniquet is a last resort, and cleaning the wound comes after bleeding is controlled. Always remember to elevate an injured limb to help reduce blood flow in cases of significant bleeding. Question 21. Which of the following actions best demonstrates a CCMA's adherence to HIPAA regulations regarding patient information? A. Discussing a patient's unusual symptoms with a colleague in the break room. B. Leaving a patient's medical chart open on the counter while stepping away. C. Obtaining a patient's signed authorization before releasing records to a third party. D. Calling out a patient's full name, date of birth, and reason for visit loudly in the waiting room. Answer C. Obtaining a patient's signed authorization before releasing records to a third party. This question focuses on a core principle of patient privacy under HIPAA, Health Insurance Portability and Accountability Act. The keywords adherence to HIPAA regulations and patient information highlight the need for strict protection of protected health information, PHI. Obtaining a patient's signed authorization is a fundamental requirement for releasing their medical records to anyone outside of direct treatment, payment, or healthcare operations, ensuring their consent and control over their own health data. Discussing patient information openly, leaving charts exposed, or announcing sensitive details loudly are all direct violations of HIPAA. Always remember that patient consent is paramount for releasing medical information. Question 22. A CCMA is reviewing a patient's medication list and notices an order for NPO after midnight. This abbreviation means A. Take medication with food. B. Nothing by mouth. C. Take as needed. D. New patient order. Answer B. Nothing by mouth. This question assesses your knowledge of common medical abbreviations, which is essential for understanding provider orders. The abbreviation NPO is widely used in healthcare and stands for nil per os, which is Latin for nothing by mouth. This instruction is crucial, especially before surgeries or certain diagnostic tests, to prevent complications like aspiration. Understanding this abbreviation is vital for patient safety and following pre-procedure protocols correctly. Always ensure you understand all medical abbreviations to prevent errors in patient care. Question 23. A CCMA is assisting a provider with a sterile procedure. The provider accidentally brushes their unsterile gown against the edge of the sterile field. What is the most appropriate action for the CCMA? A. Cover the affected area of the sterile field with a fresh sterile drape. B. Inform the provider, consider the sterile field contaminated, and prepare a new one. C. Observe if any instruments were directly touched by the unsterile gown. D. Continue the procedure, as minor contact usually does not cause contamination. Answer B. Inform the provider, consider the sterile field contaminated, and prepare a new one. This question tests your understanding of maintaining sterility in a clinical setting and responding to breaches. The keywords unsterile gown against the edge of the sterile field clearly indicate a contamination event. Any contact between an unsterile object and a sterile field renders the entire field contaminated, regardless of whether specific instruments were directly touched. The most appropriate and safest action is to immediately inform the provider, consider the entire field compromised, and then prepare a completely new sterile field to ensure patient safety and prevent infection. When in doubt, always consider it contaminated to protect the patient. Question 24. A CCMA is performing a venipuncture on a patient with fragile veins. Which of the following actions is most appropriate to prevent vein collapse? A. Use a 23-gauge butterfly needle. B. Apply a tight tourniquet for a longer duration. C. Use a larger gauge needle, e.g., 18 gauge. D. Have the patient vigorously pump their fist. Answer A. Use a 23-gauge butterfly needle. This question focuses on adapting venipuncture techniques for challenging patient conditions, specifically fragile veins. The keyword fragile veins suggests a need for a less invasive approach to prevent damage. A 23-gauge butterfly needle has a smaller bore and is less likely to cause vein trauma or lead to vein collapse compared to larger needles. A smaller needle also provides more control, which is beneficial for fragile veins. Applying a tight tourniquet or having the patient pump their fist vigorously can increase pressure and risk damage, while a larger needle is counterproductive. Always select the smallest appropriate needle for fragile veins to minimize trauma. Question 25. A CCMA is assisting with a minor surgical procedure where a local anesthetic is being used. Which of the following is a common adverse reaction to local anesthetics the CCMA should monitor for? A. Hypertension. B. Tachycardia. C. Bradycardia. D. Hyperglycemia. Answer B. Tachycardia. This question assesses your awareness of common side effects associated with local anesthetics, which is crucial for patient monitoring during procedures. While local anesthetics are generally safe, they often contain epinephrine, a vasoconstrictor, to prolong their effect and reduce bleeding. A common adverse reaction, especially if some anesthetic is absorbed systemically or if a patient is sensitive, is tachycardia, an increased heart rate, due to the stimulating effect of epinephrine. Hypertension can also occur, but tachycardia is a more frequent and noticeable sign. Always monitor vital signs closely when local anesthetics are administered, especially for changes in heart rate. Question 26. A CCMA is obtaining a fecal occult blood test, FOBT, from a patient. The patient reports having eaten a large steak for dinner the previous night. What is the most appropriate action? A. Instruct the patient to proceed with the collection, as diet does not affect the test. B. Collect the sample as usual, but note the dietary intake on the requisition. C. Advise the patient to postpone the test and adhere to dietary restrictions for 3 days prior. D. Explain that the test is likely to be positive due to the steak and proceed with the collection. Answer C. Advise the patient to postpone the test and adhere to dietary restrictions for 3 days prior. This question tests your knowledge of pre-analytical variables that can affect lab test accuracy, specifically for a fecal occult blood test, FOBT. The keyword eaten a large steak is critical because red meat contains heme, which can cause a false positive result on a guaiac-based FOBT, mimicking actual gastrointestinal bleeding. To ensure accurate results, patients must adhere to specific dietary restrictions, avoiding red meat, certain vegetables, like broccoli, turnips, and some medications for at least 3 days before and during the collection period. Always educate patients thoroughly on pre-test preparations to avoid inaccurate results and unnecessary anxiety. Question 27. When preparing a patient for a Holter monitor application, the CCMA should instruct the patient to A. Avoid showering or bathing during the monitoring period. B. Engage in strenuous exercise to trigger symptoms. C. Remove the monitor if they experience any chest pain. D. Limit their daily activities to ensure accurate readings. Answer A. Avoid showering or bathing during the monitoring period. This question assesses your understanding of patient education for specific cardiac monitoring devices. The key phrase Holter monitor application refers to a portable device that continuously records the heart's electrical activity, typically for 24 to 48 hours. The most important instruction is to avoid showering, bathing, or swimming because the monitor and its electrodes are not waterproof, and getting them wet can damage the device or detach the electrodes, compromising the recording. Patients should maintain normal activities and keep a diary of symptoms, but water exposure must be avoided. Always ensure patients know how to care for their monitoring device to get the best diagnostic information. Question 28. A CCMA is asked to schedule an MRI for a patient. Which of the following pieces of information is most crucial to confirm with the patient before scheduling? A. Their preferred time of day for the appointment. B. If they have any metal implants or pacemakers. C. Their transportation needs to the facility. D. If they have any dietary restrictions before the scan. Answer B. If they have any metal implants or pacemakers. This question highlights a critical safety consideration for specific diagnostic imaging procedures. The keyword MRI, magnetic resonance imaging, is crucial because MRI machines use powerful magnets. The presence of metal implants, such as pacemakers, certain types of aneurysm clips, or cochlear implants, is an absolute contraindication for an MRI due to the risk of device malfunction, heating, or movement, which could cause serious injury or death. Confirming this information is a vital safety screening step before any MRI is scheduled. Always prioritize patient safety by thoroughly screening for contraindications before ordering or scheduling high-risk procedures like an MRI. Question 29. A CCMA is documenting in a patient's electronic health record, EHR. They discover a factual error in a previous entry made by another CCMA. What is the appropriate action to correct the error? A. Erase the incorrect entry and type in the correct information. B. Draw a single line through the incorrect entry, write error, initial, date, and enter the correct information. C. Add an addendum to the chart with the correct information, referencing the original entry. D. Notify the provider and have them correct the entry. Answer: C. Add an addendum to the chart with the correct information, referencing the original entry. This question tests your knowledge of proper medical record documentation and error correction, especially within an electronic health record (EHR) system. The keyword factual error in a previous entry made by another CCMA means you cannot directly alter someone else's documented information. In an EHR, you typically cannot erase or strike through an entry as you would in a paper chart. The appropriate method is to create an addendum, which is a new entry that clarifies, corrects, or adds information, clearly stating it's a correction to a previous note and referencing the original entry. This maintains the integrity and chronological order of the legal document. Always remember to add an addendum for corrections in an EHR, preserving the original record. Question 30. A CCMA is preparing to collect a sputum specimen for acid-fast bacilli, AFB, testing. Which of the following instructions is most important to give the patient? A. Collect the specimen immediately after eating breakfast. B. Collect the specimen after vigorously exercising. C. Collect the first morning specimen before eating or drinking. D. Collect the specimen after rinsing the mouth with mouthwash. Answer: C. Collect the first morning specimen before eating or drinking. This question focuses on specific collection guidelines for diagnostic microbiology specimens. The key phrases sputum specimen and acid-fast bacilli, AFB, testing point to the need for a high-quality sample to detect mycobacteria, often associated with tuberculosis. The most important instruction is to collect the first morning specimen before eating or drinking because overnight accumulation allows for a more concentrated sample of respiratory secretions, increasing the likelihood of detecting the organisms. Eating or drinking can dilute the specimen, and mouthwash may kill or inhibit some bacteria. Always emphasize proper timing for sputum collection to ensure diagnostic accuracy. Question 31. A CCMA is performing a urinary catheterization. After inserting the catheter and observing urine flow, what is the next immediate step? A. Inflate the balloon with the correct volume of sterile water. B. Secure the catheter to the patient's leg. C. Collect the urine sample. D. Connect the catheter to the drainage bag. Answer: A. Inflate the balloon with the correct volume of sterile water. This question assesses your sequential understanding of a urinary catheterization procedure. The key phrase after inserting the catheter and observing urine flow indicates you are at a specific point in the procedure. Once urine flow is established, confirming the catheter is in the bladder, the immediate next step is to inflate the retention balloon with the specified amount of sterile water. This inflation anchors the catheter within the bladder, preventing it from slipping out. Subsequent steps include securing the catheter and connecting it to the drainage system. Always ensure the balloon is properly inflated to secure the catheter before proceeding. Question 32. A CCMA is preparing a patient for a cardiac stress test. Which of the following medications should the CCMA confirm the patient has withheld prior to the test? A. Levothyroxine. B. Metformin. C. Beta blockers. D. Acetaminophen. Answer: C. Beta blockers. This question delves into specific pre-test instructions for cardiac diagnostic procedures, requiring knowledge of medication effects. The keyword cardiac stress test implies the heart's response to exertion will be measured. Beta blockers are medications that slow the heart rate and reduce the heart's contractility, which can significantly blunt the heart's physiological response to stress, making the test results inaccurate or inconclusive. Therefore, patients are typically instructed to withhold beta blockers for a specific period before a stress test, under the provider's guidance. Always verify medication adherence to pre-test instructions, especially for cardiac evaluations, to ensure accurate results. Question 33. A patient calls the clinic complaining of flu-like symptoms, including fever, body aches, and fatigue. The CCMA should identify these symptoms as characteristic of which chain of infection component? A. Reservoir. B. Portal of exit. C. Susceptible host. D. Infectious agent. Answer: D. Infectious agent. This question tests your understanding of the chain of infection, a fundamental concept in infection control. The keywords flu-like symptoms, including fever, body aches, and fatigue, describe the clinical manifestations of the illness itself. These symptoms are caused by the infectious agent, e.g., influenza virus, which multiplies in the body and produces disease. The reservoir is where the agent lives, the portal of exit is how it leaves, and a susceptible host is someone who can get sick, but the symptoms themselves represent the activity of the infectious agent. Recognizing the components of the chain of infection helps in breaking the cycle of disease transmission. Question 34. A CCMA is processing a specimen for a culture and sensitivity test. Which of the following is the most critical step to ensure accurate results? A. Refrigerate the specimen immediately after collection. B. Transport the specimen to the lab within 30 minutes. C. Ensure the specimen is collected using sterile technique. D. Mix the specimen thoroughly before sending it to the lab. Answer: C. Ensure the specimen is collected using sterile technique. This question focuses on the crucial aspect of pre-analytical integrity for microbiology samples. The keyword culture and sensitivity test indicates that the goal is to identify specific microorganisms causing infection. The most critical step is ensuring the specimen is collected using sterile technique, e.g., midstream clean catch for urine, proper swabbing for wounds, to prevent contamination from normal flora or environmental bacteria. Contaminated samples lead to inaccurate results, potentially delaying correct diagnosis and treatment. While transport time and refrigeration are important, a clean sample is foundational. Always prioritize sterile collection to get meaningful culture results. Question 35. A patient scheduled for a colonoscopy asks the CCMA why they need to consume only clear liquids for 24 hours prior. What is the most appropriate explanation? A. To prevent nausea during the procedure. B. To allow the provider to visualize the colon clearly. C. To reduce the risk of allergic reaction to the sedative. D. To accurately measure the colon's dimensions. Answer B. To allow the provider to visualize the colon clearly. This question assesses your ability to provide patient education regarding pre-procedure instructions and their rationale. The keywords colonoscopy and clear liquids directly relate to preparing the bowel. The primary reason for a clear liquid diet and bowel preparation before a colonoscopy is to thoroughly cleanse the colon, removing all fecal matter. A clean colon allows the gastroenterologist to clearly visualize the entire lining for polyps, inflammation, or other abnormalities, ensuring the most accurate diagnostic examination. Always explain the why behind instructions to improve patient understanding and compliance. Question 36. A CCMA is asked to prepare an exam room for a patient experiencing syncope. Which of the following equipment should be readily available? A. Electrocardiogram, EKG, machine. B. Oxygen and ammonia inhalants. C. Automated external defibrillator, AED. D. Glucose monitor and insulin. Answer B. Oxygen and ammonia inhalants. This question assesses your readiness for common medical emergencies in an outpatient setting. The keyword syncope refers to fainting, which often results from a temporary decrease in blood flow to the brain. While a provider might order an EKG later to investigate the cause, and an AED is for cardiac arrest, oxygen can help improve cerebral perfusion, and ammonia inhalants, smelling salts, can be used to stimulate the respiratory and circulatory systems, helping to rouse a patient who has fainted. Having these readily available allows for immediate intervention for a syncopal episode. Always be prepared with basic emergency supplies for common patient presentations. Question 37. A CCMA is explaining the results of a rapid strep test to a patient. The test is positive. Which of the following statements is most appropriate for the CCMA to make? A. The test is positive, so you definitely have strep throat. B. The provider will need to review these results to confirm the diagnosis. C. This indicates the presence of group A streptococcus, and the provider will discuss treatment options. D. You have strep throat, and we will prescribe antibiotics for you. Answer C. This indicates the presence of group A streptococcus, and the provider will discuss treatment options. This question tests your ability to communicate lab results accurately and within your scope of practice. The keywords rapid strep test and positive indicate a specific finding. As a CCMA, it is within your scope to state the factual result, presence of group A streptococcus, but it is crucial not to make definitive diagnoses or prescribe treatment. Instead, you should explain what the finding means and defer the diagnosis, treatment plan, and medication prescription to the licensed provider. Always report factual information and ensure the provider communicates the diagnosis and treatment plan to the patient. Question 38. In the event of a chemical splash to the eyes, what is the immediate and most crucial action a CCMA should take? A. Apply a sterile eye patch. B. Irrigate the eyes with copious amounts of water for at least 15 minutes. C. Administer pain medication. D. Call emergency services immediately. Answer B. Irrigate the eyes with copious amounts of water for at least 15 minutes. This question addresses immediate first aid for chemical exposure, a vital aspect of workplace safety. The keywords chemical splash to the eyes highlight a medical emergency that requires swift and decisive action. The most crucial immediate step is to irrigate the affected eye, with copious amounts of water for at least 15 minutes using an eye wash station or other water source. This helps dilute and wash away the chemical, minimizing damage. While calling emergency services is important, the immediate irrigation cannot be delayed. Always prioritize immediate and thorough irrigation for chemical eye exposures to prevent severe injury. Question 39. A CCMA is documenting a patient's chief complaint using the SOAP method. Which of the following would be categorized under the subjective section? A. Patient's vital signs. B. Provider's diagnosis. C. Patient states, "I've had a headache for 3 days." D. Results of a lab test. Answer, C. Patient states, "I've had a headache for 3 days." This question tests your understanding of the SOAP, subjective, objective, assessment, plan, method of documentation, a common format in healthcare. The keyword subjective refers to information reported by the patient, which cannot be directly observed or measured by the healthcare professional. A patient's statement about their symptoms, like "I've had a headache for 3 days," falls directly into the subjective category as it's their personal experience. Vital signs and lab results are objective, and the diagnosis is part of the assessment. Always remember that the S in SOAP is for what the patient tells you. Question 40. A CCMA is instructing a patient on how to collect a clean catch midstream urine specimen. Which step is most important to prevent contamination? A. Collect the first portion of urine in the container. B. Cleanse the perineal area from front to back. C. Discard the initial urine flow before collecting the sample. D. Avoid touching the inside of the lid of the specimen cup. Answer, C. Discard the initial urine flow before collecting the sample. This question assesses your knowledge of proper clean catch urine collection technique, crucial for accurate urinalysis and culture results. The keyword "most important to prevent contamination" directs you to the step that minimizes the introduction of external bacteria into the sample. The midstream part of the clean catch method means the patient should begin to void into the toilet, allowing the initial flow to flush out microorganisms from the urethra, and then collect the subsequent urine into the sterile cup. While cleansing is also vital, discarding the initial flow directly addresses urethral contamination. Always emphasize the midstream collection to obtain the cleanest possible urine sample. Question 41. Which of the following describes the legal concept of respondeat superior in a medical office? A. The patient is responsible for understanding their treatment plan. B. A physician is liable for the actions of their employees, even if not directly present. C. Medical assistants are personally responsible for all their actions. D. The hospital is ultimately responsible for all care provided within its walls. Answer, B. A physician is liable for the actions of their employees, even if not directly present. This question tests your understanding of an important legal concept in healthcare, specifically respondeat superior. This Latin phrase means "let the master answer," and in a medical context, it holds the employer, often the physician or healthcare facility, legally responsible for the wrongful acts or omissions of their employees, like CCMAs, when these acts occur within the scope of their employment. It acknowledges that the employer has control over their employees' actions. This legal principle ensures accountability and protection for patients, even if the supervising physician isn't directly present during every action. Question 42. A CCMA is assisting with a patient who is experiencing a grand mal seizure. What is the most appropriate immediate action? A. Restrain the patient's limbs to prevent injury. B. Insert a tongue blade into the patient's mouth. C. Turn the patient onto their side to prevent aspiration. D. Call 911 immediately while observing the seizure. Answer, C. Turn the patient onto their side to prevent aspiration. This question assesses your knowledge of immediate and safe interventions during a grand mal, tonic-clonic seizure. The keywords grand mal seizure indicate a severe seizure episode. The most appropriate immediate action is to turn the patient onto their side, which helps maintain an open airway and prevents aspiration of vomit or saliva into the lungs. Attempting to restrain limbs or insert objects into the mouth can cause injury to both the patient and the assistant. While calling for help is important, ensuring airway patency and safety is the immediate priority. Always protect a seizing patient by ensuring their safety and open airway. Question 43. A CCMA is preparing to draw blood from a patient who has an N4 infusion running in the left arm. Where should the CCMA attempt to draw blood? A. Proximal to the 4 site in the left arm. B. From the 4 line itself. C. Distal to the 4 site in the left arm. D. From the right arm. Answer, D. From the right arm. This question tests your understanding of proper venipuncture site selection when N4 infusion is present, a critical aspect of preventing sample contamination. The keyword for infusion running in the left arm means that drawing blood from that arm, especially near or in the same vein, risks diluting the blood sample with 4 fluids or medications, leading to inaccurate test results. The most appropriate and safest site is the opposite arm, the right arm, to ensure an uncontaminated specimen. Drawing from the 4 line itself is usually performed by nurses or specialized personnel and requires specific protocols, and drawing distal to N4 is still risky for dilution. Always choose the arm without N4 for venipuncture when possible. Question 44. A CCMA is performing wound care and notices purulent drainage from a patient's incision. This type of drainage indicates A. Normal wound healing. B. Presence of serous fluid. C. Potential infection. D. An allergic reaction. Answer, C. Potential infection. This question assesses your ability to recognize abnormal wound characteristics, a vital part of patient assessment. The keyword purulent drainage is a clinical term for thick, opaque, often yellow, green, or brown discharge, commonly known as pus. Purulent drainage is a classic sign of a bacterial infection in a wound. Normal wound healing typically involves serous, clear, watery, or serosanguineous, pinkish, watery, drainage, not purulent. Recognizing this type of drainage signals the need for further evaluation and potential intervention for infection. Always report purulent drainage to the provider immediately. Question 45. Which of the following legal doctrines protects a healthcare professional who provides emergency care in good faith outside of a medical facility? A. Malpractice. B. Respondeat superior. C. Good Samaritan Law. D. Patient Self-Determination Act. Answer, C. Good Samaritan Law. This question tests your knowledge of legal protections for healthcare professionals in specific situations. The keywords emergency care in good faith outside of a medical facility directly point to the purpose of Good Samaritan laws. These laws are designed to encourage people, including healthcare professionals, to render aid in emergency situations by protecting them from liability for civil damages if their actions were performed voluntarily, in good faith, and without gross negligence or reckless misconduct. This encourages intervention without fear of legal repercussions. Always remember that Good Samaritan laws are there to protect those who offer help in an emergency. Question 46. A CCMA needs to document a patient's refusal of a prescribed medication. Which of the following is the most appropriate action? A. Discard the medication and continue with the next task. B. Document the refusal, the reason, if given, and inform the provider. C. Persuade the patient to take the medication, explaining its benefits. D. Document the refusal and wait until the next appointment to inform the provider. Answer B. Document the refusal, the reason, if given, and inform the provider. This question focuses on proper documentation and patient autonomy in medication administration. The keyword refusal of a prescribed medication indicates a patient's right to decline treatment. The most appropriate action is to meticulously document the patient's refusal, including any reason they provide, and then immediately inform the prescribing provider. This ensures the medical record is accurate, the provider is aware of the non-compliance, and they can then determine the next steps, such as exploring alternatives or re-educating the patient. Never force medication, and always ensure accurate, timely communication regarding patient refusal. Question 47. A CCMA is educating a patient about the proper use of a metered dose inhaler, MDI. Which instruction is most critical for ensuring the medication reaches the lungs effectively? A. Shake the inhaler vigorously before each puff. B. Inhale slowly and deeply through the mouth as you activate the inhaler. C. Exhale completely before activating the inhaler. D. Hold your breath for approximately 10 seconds after inhaling the medication. Answer D. Hold your breath for approximately 10 seconds after inhaling the medication. This question assesses your knowledge of effective patient education for medication administration, specifically for an MDI. The keyword most critical for ensuring the medication reaches the lungs effectively highlights a key step for drug delivery. After inhaling the medication from the MDI, holding one's breath for about 5 to 10 seconds allows the medication particles time to settle deep into the airways of the lungs, maximizing absorption and therapeutic effect. Without this pause, much of the medication might be exhaled immediately. Always emphasize holding the breath after inhalation to get the most benefit from an MDI. Question 48. A CCMA is assisting with a liquid nitrogen cryotherapy procedure. Which of the following personal protective equipment, PPE, is most important for the CCMA to wear? A. Standard examination gloves. B. Surgical mask and face shield. C. Heavy, insulated gloves and eye protection. D. Sterile gown and cap. Answer C. Heavy, insulated gloves and eye protection. This question tests your knowledge of specific safety precautions for potentially hazardous procedures. The keyword liquid nitrogen cryotherapy indicates the use of an extremely cold substance, -196 degrees C or -321 degrees Fahrenheit, that can cause severe freeze burns on contact. Therefore, the most important PPE for a CCMA assisting with this procedure includes heavy, insulated gloves designed for cryogenic temperatures to protect hands from frostbite, and eye protection, like safety glasses or a face shield, to protect against accidental splashes. Standard exam gloves offer no protection against such extreme cold. Always choose PPE appropriate for the specific hazards of the procedure. Question 49. A CCMA is performing an EKG on a patient who has a significant amount of hair on their chest. Which of the following actions is most appropriate to ensure good electrode contact? A. Apply extra conductive gel to the electrodes. B. Use larger electrodes. C. Shave or clip the hair at the electrode sites. D. Apply medical tape over the electrodes to secure them. Answer C. Shave or clip the hair at the electrode sites. This question addresses a common challenge in EKG lead placement and maintaining good signal quality. The keywords significant amount of hair and ensure good electrode contact highlight the issue. Hair acts as a barrier between the skin and the electrode, interfering with electrical conduction and leading to artifacts or poor quality readings. The most effective solution is to carefully shave or clip the hair from the specific areas where the electrodes will be placed, ensuring direct skin-to-electrode contact. While gel helps, it can't overcome a dense hair barrier. Always prepare the skin properly, including hair removal if necessary, for optimal EKG results. Question 50. A CCMA is responsible for maintaining the clinic's inventory of controlled substances. Which of the following is a mandatory requirement for their storage? A. Stored in a locked cabinet or safe separate from other medications. B. Kept in the main medication cabinet for easy access. C. Stored in a clearly labeled, unlocked drawer. D. Rotated frequently to the front of the shelf for visibility. Answer: A. Stored in a locked cabinet or safe separate from other medications. This question tests your knowledge of critical legal and safety requirements for handling controlled substances. The keyword controlled substances refers to medications with abuse potential, which are subject to strict regulations by the DEA, Drug Enforcement Administration. A mandatory requirement is that these substances must be stored securely in a substantially constructed, locked cabinet or safe that is separate from other non-controlled medications to prevent diversion and theft. Maintaining meticulous inventory records and secure storage are essential legal responsibilities. Always adhere strictly to DEA guidelines for controlled substance storage and documentation to ensure compliance and patient safety.